Ndubuisi.
Talk about what's going on today.
Well, today, Saturday, June 29th, 2024, is the first Finding Scoliosis Kindly educational symposium organized by me to raise awareness for scoliosis, which is a spinal condition that affects kids and adults. I think raising awareness for scoliosis is really important, so that way families know to get their kids screened for the condition, and so kids with scoliosis will receive the support and compassion that they need to thrive and manage their condition. I have scoliosis myself, and my experience with it and seeing other kids struggle with it and face challenges with it inspired me to want to educate the community and help other people.
These are amazing Mendon High students. Say hi.
Mic check, testing.
Welcome. I'm Dr. OlaRose Ndubuisi, OlaRose's mom. Thank you for being here supporting the Finding Scoliosis Kindly educational symposium organized and hosted by Miss OlaRose Ndubuisi. So we're going to get started with introducing the MC for the event, the lovely, talented Miss Mikhaela Singleton, Sunrise TV.
I had the very great honor of meeting OlaRose earlier this year when she was named an emerging visionary, got a $5,000 grant to continue her work with FISK, and all getting some recognition for all the great work that she has done. So in the, I don't want to say about maybe 3 or 4 months that I've gotten to know her, I've just been very, very impressed by all of her hard work, and I'm sure you all are and would be too. So I thank you for being here. Bring up OlaRose so you can get to know her a little bit more through her poem that she actually wrote. She's also a poet laureate. So
Thank you, Ms. Singleton, and thank you, Mayor Evans, for coming. We appreciate your time. Good afternoon, everyone. Thank you all for being here and supporting this event. My name is OlaRose Ndubuisi. I'm 17 years old. I'm the founder of the Finding Scoliosis Kindly project and the organizer of this event, the 2024 Finding Scoliosis Kindly Educational Symposium. I was born extremely premature at 1 pound birth weight, and I thought surviving prematurity would be the toughest thing that I would have to face in life. I was wrong. I was diagnosed with severe adolescent idiopathic scoliosis when I was 14 years old, and it has completely changed my life. Educating myself about my diagnosis helped me to embrace scoliosis and face it bravely. Scoliosis can happen to anyone, and knowledge can empower everyone. Raising awareness for scoliosis can encourage families to screen their children for scoliosis early, help people better understand the physical and emotional effects of the condition, and foster a supportive and compassionate environment for kids at home, at school, and in the greater community for children with invisible struggles like scoliosis. I'm happy to share that in April 2024, I was announced as the 2024-2025 New York State Youth Poet Laureate. I'm grateful for this title, especially because I won by submitting my poems about scoliosis. The poem that I will read for you today is one of the poems that I submitted to be the New York State Youth Poet Laureate. Scoliosis is a curved path to heaven. I wrote this poem when I was 16 years old, and it tells the story of my scoliosis journey. I'm grateful that I have been able to use poetry to turn my pain into something beautiful and relatable. Now I will recite my poem, Scoliosis is a Curved Path to Heaven. God covered my eyes and told me to walk straight. I walked forward. I couldn't wait to open my eyes. 2 years ago, I was told that I had scoliosis. I buried my head in poetry, hoping that if I wrote enough similes, the strain in my neck would be relieved, and suffering would be like a nursery rhyme. My pain, from my neck to my back, was constant. It ranged from the pricking of thorns to the stabbing of a sword. My tolerance was low, but I remained silent, afraid to let my feelings overflow. I didn't show that I was hurting. I didn't want to be a burden. I would say, I'm fine, when my body felt twisted and torn. Scoliosis taught me to be more perceptive. Not all trees were perfect and straight. Some were curved, like my spine. When I tilted my head to see from their point of view, I learned that suffering had the power to either ruin or renew. My love for trees stretched beyond to the birds that perched on branches and the dainty flowers that sprouted around a tree's roots. I attended physical therapy and yoga every week, seeking my stolen strength and stability. Physical therapy introduced me to other girls with curved spines. I no longer spoke in rhymes. My pain didn't cower or find a metaphor to hide behind. Weathering the storm together, we painted streaks of blue across a blank canvas. And our laughter was the sunlight that peeked through the clouds. Creativity repurposed our pain instead of retaining it. When I was 15, before my scoliosis surgery, I blindly signed a severing contract, carving my name into the side of a tree. The tethers bound me to the light, and the branches lifted me to my destiny. I never want to open my eyes again. Thank you. My perspective of scoliosis. I first sketched it in my notebook when I was 15 years old in 10th grade, and then I painted it on my iPad. This structure right here is my curved spine. It is red at the bottom in my lumbar spine to show that I have more back pain there, and it is yellow at the top in my thoracic spine to show that I have less back pain there. My spine transforms into a tree with branches to show that having scoliosis gave me a deeper appreciation for nature. I realized that not all trees are straight and perfect, some are curved like my spine, and this reminded me to be strong and confident in my individuality. The tree house here represents my heart and how scoliosis has made me a more compassionate person. I've been able to reach out and meet other kids who have scoliosis.
OlaRose, thank you for inviting me here today. OlaRose, I just want to commend you for being a poet laureate at 17 years old. That's a big deal. And OlaRose, I want you to know that what you are doing is something that may have an impact on people, and they may not tell you, or they may not hear, or you may not hear from them. But just the presence, your poetry, your art, your advocacy can make a difference in people's lives because they know that there's someone that they can look to. So I want to encourage you to continue on this journey and encourage all of us in this room to continue on this journey of education and compassion, because we need more compassion in this world. If you turn on the news, sometimes you might not want to get out of bed. But coming to events like this, I think, reinforces for all of us in the community that there are people that still care about the humanity of people, probably turned on News 8 and saw your story, and saw this young 17-year-old girl that was born 1 pound, but still continued to overcome over and over again. I want you to continue to press on, because by you continuing to press on, you're giving inspiration to a whole nother group of young people who may not know what to do, or who may feel disconnected, who may feel left out, who may feel isolated, who may feel alone. What you said is, you don't have to feel isolated. You don't have to feel alone. In fact, so much so that you can make your voice heard and you can be a poet laureate one day. That you can make your voices heard, that you can make the mayor come out on a rainy Saturday with his Jordans on. I would not be the mayor if I did not come with something for you. I wanted to present to you a proclamation, OlaRose, for organizing this event, but also for recognizing National Scoliosis Awareness Month. I wanted to give you this mayoral proclamation, and I'll just read the last 2 whereases, and it says, whereas OlaRose has organized the Finding Scoliosis Kindly Educational Symposium, held on June 29, 2024 at the Henrietta Public Library, where she will continue her mission to educate and support those affected by scoliosis. And whereas the City of Rochester recognizes the importance of supporting initiatives like the FISK project and applaud OlaRose for her outstanding contributions to scoliosis awareness and her exemplary leadership at New York State as New York State's Youth Poet Laureate. Now, therefore, I, Malik D. Mayor of the City of Rochester, do hereby proclaim June 2024 to be National Scoliosis Awareness Month. So I do this for you. And congratulations on all your hard work.
I've met other kids with scoliosis. Seeing other kids like me validated my experience and my emotions. It also helped me to learn to love talking about my scoliosis and hearing other people's scoliosis experience. I also realized that everyone's scoliosis journey is different and unique. The Finding Scoliosis Kindly project. Some kids with scoliosis are bullied, feel alone, and have difficulty talking about their condition. Inspired by this and my experience, I founded the Finding Scoliosis Kindly project when I was 15 years old in October 2022 to raise awareness for scoliosis, educate people about the physical and emotional effects of the condition, and to advocate for early management and screening. My project includes an educational research survey that has reached 25 US states and 18 countries worldwide, a t-shirt fundraiser, and free scoliosis screening in the United States and Nigeria and West Africa. I also founded the Finding Scoliosis Kindly Club at my high school to teach kids about scoliosis and how to express themselves positively through creative outlets. This is the logo for FISK that I designed, and this is a t-shirt for the t-shirt fundraiser, which features my art and my poetry about scoliosis. 100% of the proceeds from the fundraiser go to supporting free scoliosis screening and education in the USA and Nigeria. These are before and after pictures of my spine. This is my spine before surgery. The lower part of my spine, the lumbar spine, is 51.0 degrees, so it's in surgical range. And in the thoracic spine, it's 31.6 degrees. This is my spine after surgery. I had a VBT, vertebral body tethering surgery. So my spine is straighter, but it's still curved. And the thoracic spine is 19.1 degrees, and in the lumbar spine it's 17.6 degrees. And there are different levels of severity of scoliosis based on your degree of curvature. This is my body before and after surgery. This is right before surgery. When I was first diagnosed, my doctor said that no one would be able to tell that I had scoliosis. I looked very straight. But right before surgery, you can see humps and protrusions in my back due to my curved and rotated spine. And then this is my body after VBT surgery. The surgery is accessed through the side with the curve. So I have scars on both sides of my body, like here. And for the surgery, my lungs were deflated to get better access to my spine. I also had a chest tube in for a few days until my lungs reinflated. While still recovering from scoliosis surgery, I traveled to Nigeria and West Africa in July 2023 with Meju International Foundation, which is my family's nonprofit organization started by my grandparents, and we provide free medical care and humanitarian services to people in the USA and Nigeria. In July 2023, in Nigeria, I held a free scoliosis seminar and I educated 300 patients and kids about scoliosis. I also screened 20 kids for scoliosis using a scoliometer and the Adams Forward Bend test. I founded the Finding Scoliosis Kindly Club at my high school in April. We do a lot of fun activities in the club. For example, we had an international service project in which over 50 students made more than 75 cards for orphans in Nigeria. My family's organization supports a local orphanage in Imo State, Nigeria. And so in July, I will hand deliver the cards to the kids at the orphanage when I go to Nigeria. This club also had a music concert with student performances, which was a wonderful opportunity for students to be able to share their love for music. And today, at the FISK Symposium, 15-year-old Yo-Yo Wu and 12-year-old Urianse Rose Patel will be performing during the musical interludes. My life after surgery, how I found happiness. I did not find happiness despite my scoliosis. I found happiness because of my scoliosis. Although scoliosis is painful, it has helped me to evolve and grow positively. I'm glad that I had access to management resources like bracing, physical therapy, and surgery because not everyone is as lucky. I'm also very thankful for my support system and my family, friends, teachers, doctors, physical therapists, and yoga instructors, especially my mom, who has been there for me and who has supported me throughout everything. Thank you for listening to my scoliosis seminar, and I hope you enjoy the FISK Educational Symposium.
Next, we have our panel of experts. We have our pediatrician panelist, Dr. Carolyn Cleary from Elmwood Pediatric Group here in Rochester. Orthopedic surgeon, Dr. Susan Nelson, and orthopedic surgeon and panelist, as well as workshop leader, Dr. Andrew Dubina, both of them from the University of Rochester. We have our physical therapist and workshop leader, Susanne Callan-Harris, who will be joining us here today. We also have our yoga instructor and workshop leader, Tricia Coleman, who will be joining us. Yes, Ms. Tricia here, as well as a panelist and parent of a child with scoliosis, Dr. Emily Culliton, adding a very unique perspective to all of our panelists who are joining us here today. OlaRose will be moderating.
Thank you, Ms. Singleton. I'm very glad to be the moderator of this panel discussion. Thank you to all of our panelists for being here and sharing your knowledge and your expertise. Today, we will discuss scoliosis, the effects of the condition, and how to manage it physically and emotionally. First, I will ask each of the panelists their questions in the order that they are sitting. Second, the panelists will get the opportunity to comment on the information that was shared. Lastly, we will open up the discussion to the audience for a question and answer session. Therefore, please wait until the panel discussion is over to ask any questions that you may have. Now, I would like to start the discussion with you, Dr. Cleary. Children are often told of the physical effects of scoliosis and are unprepared for the emotional toll that it may have on them. As a pediatrician, when you diagnose children with scoliosis, how do you support them emotionally, or what is your first piece of advice to them?
I think, as you pointed out in your presentation, having information is important. Scoliosis is common, as you said, about 3% of teens get scoliosis, and unfortunately, most of those people don't end up needing bracing or surgery, but they may do other forms of treatment, as we discussed, like physical therapy. So understanding the illness, understanding its impact on that person, seeking information, just as you said. I think supporting the patient in asking any questions that they have, and also in saying how it affects them, because as you pointed out, everybody is different effects emotionally, physically, in their life.
As I mentioned in my seminar with scoliosis, a spine can curve into an S or a C shape. This leads me to my next question for you. What is the difference between a C and an S spinal curve? Does one curve give rise to certain symptoms, and how does that affect surgical options?
So most people that walk have S-shaped curves because if one's a compensatory curve and it's compensating for the other curve. So if you want to center your head above your pelvis, kind of how I explain it in the office, if you want to center your head above your pelvis, if you have a curve in one direction, you kind of have to have something bringing you back. Otherwise, you lean way off to the side. Children with neuromuscular conditions, one such thing as cerebral palsy, can give you more of a C-shaped curve.
So I have a few questions for Dr. Nelson. When is surgery recommended for scoliosis? Is there an ideal age or degree of spinal curvature recommended for surgery?
That's a great question, and it really depends on the type of scoliosis. So OlaRose mentioned in her presentation that you can get scoliosis for lots of different reasons. And so that's maybe like a bigger discussion, but particularly for adolescent idiopathic scoliosis, it's not necessarily an age, right? You mentioned it's kind of from 10 to young adulthood, right? And so any of those ages are fine for surgery. And so there's not an ideal age within that range for adolescent idiopathic scoliosis. We like people to be, in terms of surgery curve size, traditionally for, spinal fusion, we say upwards of usually 50 degrees.
Ms. Callan-Harris, I would like to ask you a few questions about physical therapy. Is there an optimal age or spinal curvature to start physical therapy? How do you know when a child is done with physical therapy?
Good question. The simple answer is the optimal age to start physical therapy is when we identify the curve. Sometimes PTs work with people of all ages, so I started out working with infants. With infants and young children, the emphasis is on developmental stages and primitive reflexes, that sort of thing. With children starting at about the age of 7 and continuing through adulthood, we use what's called scoliosis-specific exercises, and those are carried out both in the clinic and in their activities of daily living. In terms of when you stop physical therapy, some people use skeletal maturity as the time to stop attending physical therapy. That's assuming that they understand their curve and how to find trunk balance in daily activities. Some people continue throughout their adulthood with an as-needed intervention when they face a new challenge. So the transition from high school to college can present a challenge because lifestyles become more sedentary.
Ms. Coleman, in your yoga class, how do you adapt yoga exercises to meet the needs and restrictions of children with scoliosis?
Thank you, OlaRose. I just have to start by saying, not only am I a yoga teacher, but I am someone with scoliosis. And I was diagnosed at a very young age and wore a back brace, and my curvature got up to about 45 degrees. So I was able to work with Susanne Callan-Harris since I was about 12. There you go, 12. And it has been a really powerful journey for me, and I truly see myself in all of my students. And it's allowed me to lead with compassion and a deep understanding of what it's like to have scoliosis, and I think that it's just added so much to my practice myself, and I feel like my inner child is being healed simultaneously while I'm able to give to my students, so it's been really powerful. So as far as adaptation in a yoga class, I do teach based on evidence-based practices and coursework that I've gone through, but a lot of it's from my own experience in yoga as well as physical therapy, and I integrate all of that into my work with my students. So one of the biggest things is teaching my students about their bodies, becoming very, very aware of every part of your mind and also of your body so that you can make your own decisions on what to do. So for instance, we use a lot of props in class, mostly blocks and straps, and I try to empower my students that those are not being used because there's a deficiency or it's weak. It's actually really powerful and really amazing to utilize these tools that help just bring the ground closer and make these poses and positions more accessible and safe. So one of my favorite things is when my students grab props on their own without me even saying anything, that's the work, and that's what my goal is.
I would like to ask you, Dr. Culliton, a few questions about your experience as a parent of a child with scoliosis. As a parent, it must be difficult to see your child going through something like this. As you navigate this journey with your child, what have you found to be helpful in managing the emotional effects of scoliosis for you or for your child?
We're new at this, so you're catching us at actually a rather
difficult week. You know, my youngest was diagnosed with scoliosis in January. We were very fortunate to find the group at Callan-Harris to kind of help us navigate some of the emotional side fairly early on, but you get this information and then you come home and then there's so many questions that come up, and just one after another leads to the next question, and it's very overwhelming. So now we're at the point my youngest picked up her brace this week and has been bravely getting used to that, and my other child was also diagnosed with scoliosis this week. So we have had a long week, but we are, you know, navigating it together, trying to remember that we're still the same people we were a few weeks ago, and we still do and love all the same things we have loved. Just knowing that we have a support system among our family, and trying to figure out how to tell friends and how to make sure we're using all the tools and doing the absolute best thing for our kids. You know, as a parent, the emotional side for yourself is constantly second guessing, are we doing all the right things? But then also helping your kids remember how strong they are and how good they are at navigating difficult times, and it's gonna make us stronger in the end.
We want to open the floor to any of you if you have any questions.
Thank you very much. I am Dr. Dubina Patel. Have you had any roadblock or difficulty convincing parents to screen their kids for scoliosis when it's that time to screen? And how did you deal with it or convince them that this is something that needs to be done?
So I'm a pediatrician. I have not found roadblocks. I know there are some New York State rules and there's screening at the school. Not every person likes to do that. Maybe they feel it's a public setting, but in the context of the exam room, and you know, it's part of the well-child exam, mostly, you know, people understand that this is important, and you know, if you have scoliosis and you want to find it, intervene early.
Hi, I just wanted to say your panel was amazing and I actually learned a lot. I'm Dr. Ndubuisi from Maryland and OlaRose Month. How many people in your practice do you routinely refer for the veteran surgery?
That's a great question. As I mentioned when OlaRose asked me the question about it, it is definitely a newer technique, which we can now actually offer at the University of Rochester, but the indications are still, as I said, being refined. And in my hands, it's a pretty narrow indication still. So by far, the vast majority of patients are still in my practice indicated for spinal fusion if we're getting to that point for adolescent idiopathic scoliosis in particular.
I agree, the panel's done amazing. And so my question was just on those x-rays that are the low dose x-rays. So maybe Dr. Dubina, or Dr. Nelson, if you could explain more how parents could request that, or what exactly that is and where that's available.
We are new office in Henrietta. I only like to see scoliosis patients at there because of the low dose x-ray machine.
Well, thank you so much for all the wonderful questions. One more hand for all of our panelists here. Thank you for contributing your expertise to the Educational Symposium today. Of course, all of their bios are on the back of your programs, so give them a check out. We're going to take a brief break. We have all of our refreshments here. Please enjoy. Ms. Wu will also be playing our musical interlude, and then we'll have those workshops.
And how can someone help?
Visiting www.findingscoliosis-kindly.org to learn more about my project, Finding Scoliosis Kindly, and the Symposium. They can also donate to Finding Scoliosis Kindly, or MIF, the Meiju International Foundation. We provide free health services and humanitarian services to people in the USA and Nigeria, and 100% of the donations we receive go to that cause. You can also help just by trying to be more aware and compassionate of the people around you. You never know what someone's going through, so it's always good to be patient and kind to people and try to look at things from someone else's perspective.